Welcome to the Place of Service Affecting Your Claims webinar. We will focus on billing the correct place of service or POS. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today I'm joined by Leanne from my team, who's going to help me with that chat down there. She's going to add some resources, ask me the questions out of the chat, whatever needs to be done, she'll be the one monitoring that. She may also be able to answer your question directly back in the chat should you put that in there. Remember to download today's presentation. Please go to our website and go to the live events section of the training center. And then also review the last slide of this presentation, which is a few disclaimers. So we want to make sure you're well aware of that. What is our goal for this webinar? Well, our objective or our goal is to avoid claims processing issues related to the place of service. That means that I do have to explain what the place of service is and give some basics. I then will provide you some resources for future use, and I'm going to answer your questions. I want to remind everyone that there are people that are new to Medicare and who did state they were new to Medicare. Their basic information is, I don't even know what a place of service is, was one question that had, or one comment that came in. The second one is, I'm very new and just beginning to understand place of service versus type of bill. So we're going to go through that to make sure that I don't lose anyone. At that point, I will stop. Again, this is our basics, and we're just going to get through a little bit on that. So just the basics. This is where we begin to put the building blocks together. If you don't understand anything leaving this section, please put it in chat. If you're missing something here, the rest of the information may not be helpful and it may not help you gain what you need to gain. We will also talk about some data and tell you what's happening and why this is important. So what is a place of service? Well, the place of service is where the patient or where the service actually occurred. This does include things for almost all claim types, it does include things for all claim types. So the first thing you have to know is that a place of service is defined by two different areas, one on a CMS claim form or an 837P electronic transaction, that's that professional transaction. It is a 2-digit code to identify the patient's location at the time of service. On the UB04 claim form or the 837I electronic transaction, this is represented by the type of bill. So the type of bill tells us whether it was a hospital, whether it was a critical access hospital, whether it was a skilled nursing facility. Also, was it inpatient or outpatient services? And then the sequence that it comes into. So there's a little bit more information when we talk about type of bill. The 2-digit code, though, does just represent the location where the service was provided. One thing that did come up very quickly was sometimes people will hear that a type of bill is 4 alphanumeric digits. First of all, it shouldn't be alpha, it should be just numeric. Second, the first digit is always a 0. So a lot of times you'll hear us refer to the second digit as the information that you might need. So for instance, you would hear a 11X for inpatient hospital. So it'd be a leading 0, which we don't often refer to. The second digit of 1 represents a hospital. The third digit 1 classifies the type of care. For instance, inpatient, outpatient, etc. And then the fourth digit, the X, that represents the frequency. So is this the first one that gets billed? Is this the final one that gets billed? Is it an intermediate? What are we doing with that? So let's talk about that for a hospital just for a second. Again, as I said, 011X is the full 4 digits. Now again, the 0 not commonly represented, so what you will hear is a 11X. This is for inpatient hospital care. A 13X is for outpatient hospital care. Skilled nursing facilities, you're going to use a 21X for inpatient care or 23X for outpatient care. Critical access hospitals, 85X or sometimes a 141. Now, somebody asked specifically about the 141, and that is for a reference laboratory. So they're not your patient, but you are performing lab services for them. That's why it's a little bit different. So it's a reference laboratory. Okay. So hopefully we got through some of those basic things. So what is the place of service? It actually physically represents where a service is performed. Someone asked, and when we're looking at a reference laboratory, is the patient actually at the lab? And the answer is no. Just like sometimes a place of service will be a little bit different when someone reads an x-ray or reads something differently, and that's because the patient may not physically be there, but it's where the provider is performing the service, such as the medical professional. So the question is, what type of issues does the place of service create, and how does a place of service affect a claim being billed? So, issue number one, it does affect an incorrect allowed amount. So CMS does look at this and say, hey, wait a minute, facility versus non-facility pricing, and it is different. Even on the physician fee schedule, there are times when that place of service affects things differently. So 26 in TC, professional versus technical, can also be pricing, facility, non-facility, or I'm sorry, facility and professional components. So it definitely is affecting the non-facility pricing portion. This is where you're getting paid for certain types of things, but not other types of things. The professional service is the example for that. And so when the facility has the overhead, you're only paid for the professional component. However, that could be a 21, okay, in a hospital, or an 11, which is an office. Now that means that as the professional, you are responsible for that type. So it's going to depend. Okay, 22 would be again outpatient office, or I'm sorry, outpatient hospital. So when we look at that, we just want to look at a variety of different items that go with that. Okay. Somebody asked about facility payments, and so this is a great opportunity to take a chance there. If you look at the critical access hospital, remember I said it's an 85X, that's paid at 101% of the reasonable cost versus the reference lab, which is a 141, but that's not paid at that reasonable cost. That's actually paid at the laboratory fee schedule. That's where the payment methodologies definitely can be different. Also, depending on how it's billed, could affect whether it's a prospective payment system for inpatient or outpatient, such as a hospital billing, which would be your 1-1 or 1-2X, or your critical access hospital, which again is that 100% of the reasonable cost. So the wrong place of service, that actual code being incorrect, a lot of things, even down to the point where if you're billing an 11 versus a 22, or 11 being office, a 22 being outpatient facility, outpatient hospital, the 22 will have a reduced cost in some cases based on the fee schedule. Okay? Now, I do want to make it clear this is not an all-inclusive list, but let's talk a little bit about some of the additional things. It will affect global versus professional procedure codes. What does that mean? Again, we talked about global being the overall code, but the professional is the 26 portion where it's a TC. Hopefully that makes sense. So when you go to bill it, it also affects by modifier, but then it also affects where is it being done at. So there's a lot that goes into that. It can affect the ancillary services, whether they're payable or not for ancillary staff. Hospitals are all included. That's part of their prospective payment system versus some of the other services for professionals where they may get additional things and they may have to follow additional rules. Administration of ejections and bundling of services are all different ways that things get affected. Someone did ask me in particular about an ambulatory surgery center. An ambulatory surgery center is a freestanding, enrolled as a freestanding facility. It is only for the ambulatory surgical centers, day surgeries where the patient goes home each night. This is different than an outpatient hospital surgical center. Outpatient hospital is part of the hospital. It's not a separation, it's not anything different. What it is just a different unit within a hospital. So ASC, separate legal entity, outpatient hospital, outpatient surgical department, just a separate area of the hospital. And that can also affect the payment methodologies. So a lot going on with that one back and forth. A couple of things that people did ask, and so I thought I would put this in at this point. This is not on a slide for you, unfortunately, but I was asked if people could have some data as to why this is or how this is effective and why are we doing this. Well, the reason that we're doing this is because the data shows that there are issues with this. The data is the claims processing data, so the information coming in, and we do break it into two different systems. The Part B claims, which are billed on a 1500 claim form or or 837P professional transaction, are by line of business Part B. Right? Now, when we say that, what we want to look at is how many claims are affected by this, or how many lines, and it's 25,152. Okay, that doesn't sound too bad when you think of our overall mass quantity, but it does affect it affects 9,354,734 claims, with a total of a little over 7,000 providers, about 17,500 beneficiaries, and about 25,000 lines. And that is just for the first quarter of 2026. So January, February, and March. So you can see the significant impact is more about the dollars. It's more about the dollars there, okay? If you're wondering how many units that would be, it's 47,783. But that doesn't mean that the type of bill doesn't affect on the UB04 side or the 837I side. It absolutely does. As an example, it affects 7,811 claims. That doesn't seem like so many, but dollar-wise, it's 4,719,860, affecting 2,388 providers with 4,408 bennies. So really it's a lot there. Now I want to also remind you that when we look at the Part A claims, which again are the UB04 and the 837I, it's 102,699 units versus the Part B, the 1,500 837P, which is only 25,183 units. So this does make a big difference when we're looking at the data. We want to make sure that we don't miss any of that. Someone asked very specific, is there a location or something we should be looking at when we're looking at the place of service? And yes, there is, but it depends on how you're filing. If you're filing in a 1500 claim form, it is item 24B. If you're filing on the 837P, so if you're filing that Part B line of business claim, it is in the claim level loop 2300, which is required. However, you could also have it in the line level loop, which would be 2400, but that's only required should it be different than the claim level loop. On the UB04, it is in a filled locator or locator 4, and the loop is 2300. There's only one type of loop on an 837I. So making sure that you have those in there. Now to further add to that question, the person who is having the issue is realizing that something's not coming through correctly. Now that's their verbiage. I don't have anything more to offer. What I do recommend that you do is contact our electronic data interchange department and have the people in your electronic filing area, whether it is a vendor that you use or whether it's someone directly from your company, whoever's helping to get that information to us, have them talk to each other, because it sounds like from the question that you submitted, something's not working right. Something's not coming through within that electronic claim. In the meantime, yes, you can file a paper claim. That this is a time when, yeah, it's a temporary situation. Shouldn't be forever. We might need, a couple months or 6 months or whatever to get that system updated and to get everything working correctly. We understand that. So therefore, you would file a paper claim. We will talk a little bit about more to find those claim instructions in just a few seconds. All right. So that brings us to the end of our basic discussion on what the place of service is. Again, it is a 2-digit code applied to a 1500 claim form or an 837P, where it is actually defined by the type of bill on a UB04 or the 837I. With that, I'm going to stop for a second and we're going to ask Leanne, hey, do we have any questions?
Tom, we do have one question. There's kind of a lot to unpack with it, so I'm going to give it to you in 2 parts. So the first part is asking, I'm with a nephrology office. Our providers do see patients in Fresenius dialysis units as well as hospital. I had claims for place of service 22, when patient came in for a fistula placement or other reasons for other procedures that were done as outpatient, claim for 90935 was denied for ESRD patient due to MSP. Um, the
Okay,
second, go ahead.
so let's stop with that one and we'll get to the
Mhm.
second, whatever that is next. But I want to remind everyone MSP is not about place of service. MSP is Medicare secondary payer, and that is an overall claims requirement coming from the Social Security Act. If you want this section, it's 1862B. And there it says that you have to get in place with this. So 22, 11, 21, all of those places services, they're all subject to MSP. Everything is subject to it. So if there's something that has to be paid in front of it, regardless of whether or not it's end stage renal disease, which would be probably, I'm going to guess, an employer based plan, then we have to make sure that we have that information on the claim. That's not regarding the place of service, that's requiring an overall criteria. So Leanne, I'll hand it back to you if you want to go on with the second portion.
Yep, and the next portion is slightly different. So another case is the patient is in jail and does not have dialysis unit due to violence, and the only way for the patient to get dialysis is in the ER only. They bill with place of service 23 90935 ESRD patient. Claim is denied. So, are these visits counted towards MSP, or if patients seen in ER as out or as outpatient for other reasons, can we bill 90935 with place of service 22 or 23 and get paid for professional services?
So we're going to go all the way back to what Leanne started with, because the patient's in jail, so Medicare secondary payer doesn't apply. This portion, this portion of Medicare, actually stops. What happens is because they're in jail and they're incarcerated, there is instructions which doesn't have anything to do with place of service. It doesn't have anything to do with where they're seen. What it is because they're incarcerated, that governing body that has them in the penal system, they're responsible for paying the claims. Now there is a way, and we'll look that up in a little while, or maybe we'll look it up now, that you can actually override that should you have information that states it's for an incarcerated patient. But again, this isn't about incarcerated or this isn't about place of service. I have a claim denied. Let's see, what's this? If I can remember how to spell incarcerated, that's going to be our first question. Oh yeah, it's right here. And they were not incarcerated. How do we update that? So this is what we're looking for. If you want to go to an article, now again, that was an FAQ. I do recommend that FAQ. It's just going to give you really good information. This is the CMS Medicare Learning Network product. Again, linked to the FAQ, and you can grab it from there. If you want our information, go ahead and just grab the first article. But so it'll come out here. If you open it up, it talks about the penal authority and their responsibility and why they should have to pay, not related to Medicare secondary payer. Instead, it says, hey, they're responsible. Now, if they don't make a payment ever for medical, then you can bill with an appropriate modifier. If you're not familiar with that modifier, then you do have to scroll down, look at the section called exceptions, and there's where the modifier is. So that's really not related to place of service. You can do it either in any place of service that you have. That's not what's going to cause this denial in the situation you're giving me. Leanne, actually, do you have anything to add to either one of those two scenarios? Or
I do not.
okay,
You
perfect.
answered it well. And that is
Now,
the end of the questions in the chat at the moment.
okay, let's go back to this then. Here we go. So resources. I do want to cover a couple of resources, and some of these resources were actually asked for by you as the overall attending population. One, the person asked for some claims processing instructions and why this is important. And so I thought I would put these two chapters together for you. Now, these are both part of the Medicare Claims Processing Manual. And if you want to go directly there, please feel free just to check your link here. And you can go directly now. I just click the top one. And it should move me, which I had this open earlier. There we go. And it will move you right there. Then you just do have to scroll through until you find the section. Or if you know what the section is, here's where the payment differential is and some of the different things you might want to read. I always recommend take a look at this section, which is 20.4.2. Again, that is your payment differential. what applies here, and it goes under the fee schedule and talks all about that. So here's some different things you might want to be aware of, places, services. I'm not going to read through all of this, but I do want to give you this as a possible item you might need or might want. Okay? Now that doesn't mean that hospital outpatient or hospital doesn't have the same thing. It does, right? Remember I talked about that. So here we have to go back. Nope. So let's go back to the slide deck. That'll be the easiest way. We're going to open this chapter. Now it's the same Medicare Claims Processing Manual. We were just in chapter 10. Let's open chapter 4. There we go. So this is going to be a different chapter, and this is about Part B hospitals, including Hospital Part B and OPS, Outpatient Prospective Payment System. This is place of service affected also, except remember it's the type of bill that affects it, because the Outpatient Prospective Payment System is slightly different. With this one, I like to tell people, check out, and I'm just going to scroll down. Look away if you don't like a fast scroll. I'll give you a word. Look away. Ooh, too far for me. Sorry, you're looking for section 170, 170. So as we get down into this fast scroll, I'm still in the 200s. There we go. You'll see hospital reporting requirements for service performed on the same day. It's got some information in there that you're going to need. Okay. Make sure that you have this portion read and understand that if you perform hospital, community mental health centers is what CMHC stands for. You want to make sure you're getting that information. But again, I always recommend look through all of these. If you do clinical or emergency services, make sure you have that. What is critical care services? All these different things that may go together, just in case you need that. Then come down into 200, and this is where you're going to see the special billing for ops and a lot of information about that. There is some different information available here that may help you with type of bill instructions. So we want to make sure we have all of that information gathered. Again, I'm not going to read through each individual section. I do think that gets to be a bit cumbersome. Somebody did ask very specifically, and this is a great question, is there a difference when we're on the CMS website? And let me just go back to the CMS website here. Is there a difference in billing from a paper claim form to a HIPAA standard transaction? So the next two slides will address this. First, if you're billing a paper claim form, you do have to look at the instructions within the internet only manuals. So again, we're going to go Medicare, regulations and guidance. Now I used a direct link to get you there. We'll walk you through the steps here. So again, Medicare, regulations and guidance, and then you're going to go to manuals. Once you're in manuals, use the internet only manuals. Paper-based manuals are old manuals, they're now retired. So you want to make sure you're in the internet only manuals. And then you get to look through all the different types of manuals. I will tell you the ones you're looking for if you're talking about completing either the UB04 or the 1500 is to make sure that you go into the Medicare Claims Processing Manual. You go to 100-04, you're going to read through all some general stuff. Here's hospital, outpatient, etc. But let's move down to the claim form instructions. Again, look away if you don't like it. There's 3 sets of claim form instructions. First is 25 and 26, and these are for the paper, and then you'll see the general electronic above it. We'll talk more about that on the next slide, which will be slide 10 when we get there. So the paper claim forms, and you need to pick which one you need, right? So let's just say let's just do the 1500 as an example. And I'm like, I don't know where this goes. Well, then you can read through and see what we have going on here. Okay. And you have all kinds of different information for you. If you don't know the exact section, then you get to go through and you kind of have to pick up here what you're looking for. Here's where it says 10.5, so you're going to see that. So you want to make sure you have that. Instructions for place of service codes. Right here, 10.5, 10.6. Let's go to 10.5. This is one question that I want to answer very, very much right away. So what happens is it explains a lot of information and then gives you various place of service codes. Okay. When we go through this, it'll list all of the different ones, and then it'll tell us, are they a facility base or a non-facility base? Right? Pharmacy, telehealth, etc. But once we get through this chart and you get to the bottom, there are some special considerations. And one of these was definitely something that was asked about from the 1500 perspective. Right here is telehealth. This was asked about. You can either choose a 2 or a 10. And you're like, I don't know what a 2 is, or I don't know what a 10 is. Well, guess what you get to do then? Go back up to the chart and figure it out. So the 2, well, we'll start with the 10 because we're scrolling that way. So let's start with the 10. Again, lots of stuff on the chart, right? 10, telehealth provided in the patient's home. So the patient is in a private residence, their home. This is what a 10 is. Okay, if we go up, we also have 2, and this is for basically telehealth other than the patient's home. So where is the patient when you're performing the telehealth? And you get to pick from a 2 and a 10. That's what the special considerations are telling you. And that's a very quick summary. Leanne, do you have anything you'd like to add to that as our E&M type person?
I do not.
Okay, just wanted to make sure. So again, we're going to scroll down a little bit back down to those special considerations because this is important. This is important as well. So telehealth was one question. I'm just getting back down there. Sorry, it takes me a second. If we get down to the special consideration, here's the prison or correctional facility. Again, you do have to have the modifier. We're not done with that one. And now we hit this one, special considerations for registered inpatients. Basically, this one is saying, hey, if the patient is inpatient, that will override the location that you did the service. So if you had an office setting, they came to your office, that's place of service 11. However, in this case, the patient was in a skilled nursing facility or in a hospital, and for some reason they got to leave for a period of time. Inpatient, registered inpatient. Then you must use the inpatient code that goes with it for place of service. But guess what you cannot also use? You cannot use the evaluation and management office codes. You have to use the appropriate code that relates to the inpatient place of service. Hopefully that answers the 2 basic questions, but again, I'm going to throw this one back out. Anything for a registered inpatient place of service, Leanne? Any kind of advice or anything else you'd like to add with that one?
It's fine.
Okay, thank you. So again, those are 2 things, and I really want you to take a minute to look at those. These 2, though, are in the paper manual, will also apply to an electronic claim. These are special considerations. These are things that we do look at. Again, there are other special considerations, and you want to take a look at it at 19 and 22 for outpatient hospital, things like that. And that's just on campus or off campus, okay? So what you want to do is make sure you're using 19 and 22 appropriately. Hopefully that answers that question as well. What I'm going to do here is just jump back and we're going to talk about electronic claims next. So while we do have the paper claim form instructions indicating where everything needs to be, remember I always recommend if you're looking for place of service, you are going to read through the instructions for completing the paper claim form, follow those special situations. Part B outpatient hospital is a little bit different because you're going to use a Part B bill type. Oop. On the electronic claims, the electronic claims do come together, and we do have information on our corporate website. This is not WPSGHA.com. This is our corporate website. So you can automatically go there. There we go. And you can see it's WPSHealth.com versus WPSGHA.com. This is our Medicare website, okay? There's the 2 different websites. One thing you can do really easily too is just type EDI or electronic data interchange right up here in the top. It'll bring you to some of the different EDI stuff, but this one will remind you that you need to go to this corporate website, okay? If you're on the corporate website, I do recommend checking out our companion guides right here. A lot of people do like the resources, which again, you can look at these if you want, but notice they are Medicare resources. If you look at the companion guides, it'll walk you through all the different steps you need for submitting institutional claim edits, professional claim edits. There's a lot of information out here. So I'm not sure what you really needed from this list. I know there's a lot there, but I wasn't really sure what you needed. Also, oops, too far. Go back for a couple of seconds here. One thing to keep in mind is these Medicare resources are really nice. This 1500 crosswalk or 5010, this is great if you're trying to translate from that manual, the paper manual, into the electronic manual and where everything goes. For the person that's having issues who said, hey, it's not coming through correctly, something's wrong, please take a look at this, share this with your electronic data interchange people, whatever you may call them, and make sure that they have this available when they try to call ours. That way they're hopefully talking the same language. Actually, they may be able to figure out the issue directly from this resource. So it's a really nice resource. I'm just not sure what your issue is and how to help you more with that. All right. Okay, let's jump in and move on. Now, these are your registration questions, and I do have quite a few to go through, and then we will open it for any questions in the chat. So please feel free to use that at this time. First question, they wanted some reference lab billing clarification on place of service when the specimen comes from a different entity. This is usually place of service 81 on a 1500. It doesn't really matter where the specimen comes from, it's just a reference lab, place of service 81. On the other hand, when it's a critical access hospital, it's a 141, and we already talked about that. That's telling us in the type of bill that it is one non-patient. It is only a reference lab. This is not your patient. So hopefully those two make sense to you. If not, put it back in the chat. Second question, is there a maximum number of days a patient can be considered an outpatient when having services performed in an outpatient hospital, but the patient required an extended stay? No, there is no maximum number of days. The extended stay may be in a skilled nursing facility, and usually that's about 30 days of the hospital discharge, but it's not necessarily a hard and dry rule. It really depends on what's going on with that patient. So I'm not really sure what we want to look at when we're looking at the outpatient hospital, the extended stay, stuff like that. Would it be a long-term care hospital versus an acute care hospital? Each one of those would have a different type of bill. So you want to make sure you're hitting the right area there. The next question, what is the correct place of service for an evaluation and management or E&M service provided in a residential SUD, substance use disorder facility? And that is based based on this question, I'm going to assume you're talking about 55. Now, let me show you why I'm saying that in that manner. So if I go back to the Medicare claims processing system or claims processing manual, and this person is billing on a 1500. So what we're looking for is this residential substance abuse treatment. Again, this is where we're getting that from, and this is considered non-facility. So hopefully that does help you a little bit there. The next question is, can you bill a 90935 place of service 23 or place of service 22 for an ESRD patient if the patient was not scheduled for dialysis and was in the ER outpatient for other reasons? And the answer is absolutely, right? You just have to make sure that you're billing the 22 or 23 appropriately. Let's go back up. And here we have emergency room hospital, 23, or on campus. So yeah, yes, you can bill either one of those. I'm not sure exactly what your situation is, but you'd have to evaluate which one is correct. What place of service should be used when billing diagnostic labs? And we're going to scroll down, because if you are the lab and you're not billing a reference lab, the actual place of service, and again, this is a 1500 biller, is 81, independent laboratory. Okay? So when we scroll through, if we look at a lot of these, you want to remember that it is going to be based on type of bill first and place of service. Why? Because if it's an outpatient hospital, you're going to use type of bill. If it's a place of service 1500 837P, then you're going to use type of service. Someone did ask if there were recent changes regarding this topic, and we did want to just make this clear. There are not a lot of recent changes regarding this topic, with the exception of PACE, or their program for all-inclusive care for the elderly. This was a one-to-one change and did change a few things there. I'm not sure what type of change you were looking for. I will ask Leanne again if she's aware of any changes that I might not be. Y'all know Medicare changes fast and frequent. So anything that you have to add, Leanne?
I'm not aware of any changes, Tom.
Okay. Again, we ask back and forth because y'all know Medicare changes sometimes a minute, sometimes in a day or a week. So we just want to make sure that we're getting you the best information. One of the questions that I was asked is very generic, and it's how can you improve the claims billing process? The first thing I'm going to tell you is start becoming familiar with the requirements in the Social Security Act, the Code of Federal Regulations, and the Internet Only Manual. Now, I have the Internet Only Manual up regarding place of service right now for a 1500 claim form. I do think this is a great place to start because a lot of these special considerations that are down here are very important. And they are where we see a lot of the errors and a lot of information not coming in correctly. So how does it start and how does this work together? The Social Security Act is the federal law that regulates all of this information. Once that's done, we need to have something codified. Tell us what's going to happen. How is CMS interpreting this? How do they want us as the claims processor to put it together? Also, how do they expect you to bill? That is the Code of Federal Regulation, or CFR. Then, last and foremost, as you're seeing here, the daily operating instructions from CMS to the MAC and to the provider are in the Internet Only Manual. And these are just sometimes called the Claims Processing Manual, the Benefit Policy Manual. So that's why we recommend that you have to become familiar with each one. And I want to make it very clear that these manuals provide a lot of information and become very complicated very quickly. So you want to make sure you're reading through each section. Don't skip the general sections. Don't skip the general sections and say, oh, well, this is the only thing that applies to me. Unfortunately, that isn't how it works. Some of the information applies to everything across the board, such as the benefits and eligibility chapters. Okay? So you want to make sure you're getting that in there. Again, this is a question about telehealth, and it says for services provided through a private practice PT clinic, if the patient is in the clinic and the PT is at a distant site, what is the appropriate place of service to be used? And again, we're going to step back and we're going to say, oh, where was the patient? In this case, they said if the patient is in the clinic, this would be 02, because they're not in a home, they're not in a private residence, they're in a clinic. And on 02, it actually tells us, such as a clinic, hospital, or other facility. Let's jump back to 02 in our manual here, and you'll be able to see that. Sorry, I apologize for the amount of scrolling back and forth in this list, but I do think it's one of the best things you can look at here. Okay, so see the special consideration. So when we look at this, provided via telehealth, patient is not located in their home and receiving the telehealth through telecommunication technology. So here we go. They're not in their home. That's why it is 02. Okay, that is all of the pre-submitted questions and the resources that I have to go through. Hopefully I answered a variety of those questions. Let's ask Leanne if we have any questions in the chat.
Tom, we do not have any additional questions in the chat.
Okay, thank you, Leanne. A couple of things that I'm going to recommend for you. When you are looking at this, one of the questions that I didn't necessarily feel like I was going to answer, but because we have time, I will, is to look at this Medicare Benefit Policy Manual, and they're billing for an excluded service. So we want to move down. We're looking at the exclusions list, general exclusions from coverage. Does the place of service matter when billing this? And the answer is no, it's an exclusion from coverage. It's not payable. So it's a different area that you're looking for. Okay, it's a different area than you're looking for. Hopefully that makes sense. But look at the exclusion list. If it's on here, if it's not something that needs to be done that way, then we're not going to be looking for a certain place of service. I hope that answers your question. All right, so before I move back, let's see if we had any questions come in while I answered that one very quickly.
Tom, we did have one question come in. It's asking if you could give an example of a different place of service codes per line for when independent lab is billing both technical and professional on a 1500 form.
Okay, so if you're doing a line item place of service for professional and technical, first, are you building it with modifiers? If not, you're going to use the independent lab and we're going to use one simple place. Now, if you're billing both the technical and professional and you're using those modifiers in that manner, yes, that's fine. Yes, that's common. Here's what you would do. You would have to look at the lab portion, and I got to get back up here. Or did I leave that one? I think I left that one. I apologize. I did leave that one. Let me go back for a second here. Okay, so you're going to scroll down and you're going to come to back to that section for completing the claim form. Now, again, this is chapter 26 and this is on a 1500. And we're going to scroll down to that place of service information. Okay, so a couple of things to keep in mind. The first thing you want to look at is yes, the lab would be an independent lab. It doesn't really matter where it's drawn at, unless it's drawn like in a facility service or something like that. So it could also be like an outpatient hospital, depending on how it's drawn or where it's drawn and what else is going on. Because remember, outpatient hospitals have to bill everything on one claim. They can't just separate certain things out. It doesn't work that way. But otherwise, you're going to bill 81 for an independent laboratory. Okay, now let's say it's being read on a different day. So you want to give an example of, hey, it's not an independent laboratory. It's actually going to be that lab code, but we're going to bill it with the 26 for the professional component. Tell me where they're at. Are they in their office? Maybe. Are they in their home office, which would both be 11? Um, are they doing it at an outpatient hospital between seeing patients at the hospital? So there would be a variety of different situations, and you really need to be able to tell me where it happened. I'm going to scroll up here. Looking for 22. Here we go. On campus. So this would be, again, they're seeing someone in a hospital, they're doing it. Are they reading it while they're actually in an emergency room? But again, they're in between patients, so they're reading this lab. That could be then billed with a 26 and a place of service 23. So there's a variety of different places that can be billed. It really just depends on how you bill it. If you're billing one global procedure, then yes, you would use the lab. If you're not using that global procedure, then the 26 really will be reflective of the date they did it, and it's going to be reflective of the correct place of service where the professional was at. It's not about the patient. In this case, no, again, just this case. Let's ask Leanne if she's got anything else she'd like to offer on that one.
Nope, I do not.
Okay. So from there, do we have any other questions?
Tom, we do not have any additional questions in the chat.
All right. Well, thanks everybody. We appreciate your time today. I would like it if you guys could take this survey. Again, I'm going to have Leanne put a link directly into the chat. Along with that link, once we close out of this webinar, you're going to get a picture like on the right side, and it's just going to have a continue button that'll take you to our survey. It's not spam. It's not malware. We're not trying to do anything, shady or shifty. This is actually a CMS survey. What we'd like you to do is include the good, the bad. I call it the good, the bad, and the ugly, but please feel free to do whatever you'd like. The good is, what did I do well? What information did we cover well? Did you like the resources that we used? The bad, what could I have done better? What would have made this more effective education based on the questions, based on whatever you've given me, okay? And the ugly is the PowerPoint presentation. Now, I will tell you that there are 5 basic questions. And in order to get into the good, the bad, and the ugly, you do have to provide additional feedback, and there are a variety of questions that go with that. So you can start just by taking 5 basic questions, grade WPS, and grade the webinar itself. Okay. But we would ask that you take this survey. Just take a couple of minutes. Again, you can do just the 5 questions, or you can say, yes, I'd like to provide some additional feedback and go from there. With that said, some things I'd like you to keep in mind. 1, you're going to get an email. Now, I don't see anyone who registered just via the phone, so I don't see anyone who called in today. What I do see is some of you did call in, and some of you do have registration with the phone system. You should get an email after the fact. Here's what the email is going to contain. 1, an opportunity to take the survey. 2, a certificate on the bottom. The certificate has contact hours. That's what you save and give to your governing body to decide whether or not you can get CEUs for this. So please read that email, open it up, take a look. It's an automated email. I will offer you 7 days to ask me additional questions regarding this content. 7 days. That starts tomorrow and we'll go for 7 additional days. The way that you're going to do that is once this closes out, obviously the chat will be gone. So you will want to make sure that you email us. We've already talked about the email, but I'm going to read it off again. wps.gha.education@wpsic.com. In the subject line, put place of service or POS webinar. For the next 7 days, I'll take any questions that you have or anything that comes to your head. Sometimes you get off and it pops in your head. What I will do then is email you back and we'll get you the answer that you need for that type of question. We would like to thank everyone for listening. We would also like to let you know that we did record this. This will be posted as an encore presentation. Again, depending on the quality of the recording, if something happens and it sounds awful or it doesn't necessarily give a good recording, then we won't be able to post it. But we do anticipate posting this. Look for that within the next 10 to 30 days. It's coming pretty fast there. If you'd like to register for other events, remember to review our live events registration. And keep in mind that later today or tomorrow morning, the presentation will no longer be available on live events. We will repost that presentation when we post the encore on our website. On behalf of myself, Leanne, and everyone else in Provider Outreach and Education, thank you for participating. We look forward to your survey comments and we hope that you'll join us in the future. You may now disconnect.